were just laughing about because we were talking about your haircut.
Hair.
Yeah. Usually people after 3-level scoliosis surgery, what you got yesterday, don't feel like talking about their
Oh, really?
haircut.
Oh, I can
No.
hardly wait to get to the shop and get it cut.
Yeah.
I didn't want to do it beforehand because
Yeah.
didn't want to get COVID.
Yeah, you know what the people a day after this kind of surgery, after old-fashioned surgery, they talk and think about how can I just not have this horrible pain?
Uh-huh.
Because every time they move even a little, that
Even
sort of
with drugs?
even with drugs
Really?
sometimes, yeah, it can
No,
be very
I
painful.
don't feel any of that. I
So
just
how
feel
bad
an
is your
ache.
pain? How bad is your pain right now?
Pardon me?
How bad is your pain right now?
Oh, I maybe 3.
3?
And that's just an ache. It's
Yeah.
it's not stabbing
Yeah,
pain.
You had pain going down the leg for years,
All the way
right?
from the hip and sometimes in the groin and all the way from the hip joint to the ankle.
How long did you have it?
2 years.
2 years. 1 to 10, how bad was that pain?
Some days I couldn't walk.
Mm-hmm. And
It was serious.
how bad is it now?
It's good now. I don't feel it now.
You don't have it now.
Not in the
so
leg.
this is the best.
The only thing I feel is right in the small of my back, a little ache.
And I put like a dozen of big screws in your back
Oh, really?
yesterday in a surgery that. My part of the surgery actually was under 1 hour. A big
Wow.
scoliosis surgery under 1 hour, and we barely lost 2 ounces of blood. So the surgery went really well, and you're just 1 day out of surgery. You're not like a
Yeah.
week out of surgery.
Yeah.
And I understand that they're going to come and walk you today.
Yeah.
And how do you feel overall? You feel ready to walk?
I feel fantastic.
Excellent.
Well, I've been up on the side of the bed already.
Okay.
And that I was a little bit shaky. They had a walker that I could lean on.
Mhm.
And I was a little bit shaky,
Mm-hmm.
but didn't hurt.
Yeah,
I
after
just have
all,
to be careful not to fall.
absolutely, and they will help you some tricks,
Yeah,
to do that.
good.
Now, vast majority of my patients after this surgery, as a matter of fact, 96% of them walk within the first day and they go home.
Well, that's good. That's
And,
wonderful.
Well, whereas after open old-fashioned surgery, very, very few people
Long
are able to
rehab.
walk even after first few
Yeah,
days.
I didn't want that long a rehab.
Yeah. Now, what you did see another surgeon, and they wanted to do old-fashioned
Yeah,
surgery. What
yeah.
made you decide to do the minimally invasive versus old-fashioned surgery?
Because of the rehab, it
Yeah.
seems to be much less invasive and a good time for rehab.
Yeah,
Not a long,
Yeah.
not 6 months. Like
Mhm.
I know people that have had regular spine surgery.
What do you know about them? Tell me.
Well,
about
I know that they have about a 5-hour surgery and
Mhm.
that afterward they got about a 6-month recovery and they're not necessarily well then.
Now, have you
You
see
talked
what
to
we are
any-
talking about? We are not talking about how we manage your horrible pain and
No.
how we get you on your feet, because those problems we solved.
Yeah.
We are talking about the next 10, 15 years,
Yeah.
about how to keep you independent, how to
Sounds
keep you
good.
garden. These are good conversations.
Sounds very good.
These are not conversations that you usually have with somebody with after open old-fashioned surgery.
Mm-hmm.
And that makes me really happy that I can, keep you on your feet.
Yeah.
Yeah. Well, otherwise, any question, any comment?
Well, I don't think so. I'm just very impressed.
Excellent. Well,
And I would hope that it stays that way. I don't know.
it will.
I think so.
You just have to be careful, though. Okay?
Well, and I have to be positive.
Yes, exactly. Well, thank you so much for the interview.